My name is Dr. Hemlata Armalaya. I am consultant pediatrician and neonatologist in Cloud9 Hospital, Tanisandra branch. So today I will be talking you regarding first aid for febrile seizure. So most parents will not be knowing what is febrile seizure. So first I will tell you briefly regarding febrile seizure. So febrile seizure is abnormal movements of the body which usually associated with fever, especially when the fever is between 38 degrees Celsius or 100.4 degree Fahrenheit. And it is usually common in children in age group of 6 months and 5 years. So there are different types of febrile seizure like simple febrile seizure, complex febrile seizure. Simple febrile seizure means if the seizure lasts for less than 15 minutes or if the seizure happening only once within 24-hour period, it is called simple febrile seizure. Complex febrile seizure means if the seizure or the abnormal movements last for more than 15 minutes or it happens multiple times in a 24-hour period, it is called complex febrile seizure. So these two things you should be aware of. And the reason why febrile seizure is happening, there is abnormal discharges of activity from the brain when the fever goes high. Okay. So that is the febrile seizure. So many parents are worried when they see the child fitting for the first time. Most of the parents get very worried, tensed and stressed out. So most important thing for the first aid is you should not get stressed out. You should calm down. You should be stress free. Most important thing you should do is you should avoid the child from getting any serious injury. So always lay the child on the floor, preferably onto one side so the child doesn't aspirate. Okay, the child has put any tight clothes, loosen the clothes up and allow the child to breathe properly and keep the room well ventilated. You can open the windows, you can open the doors. If the child is having high fever, you can preferably do any tepid sponging so that helps to bring down the fever, but don't give any medications through the mouth because it can get aspirated easily if the child is fitting. Even then you should give some time for the child to recover. Post the febrile seizures, most of the kids will be drowsy. They will be drowsy for at least 30 minutes. So you should not be get worried if the child is not active and drowsy. So it's a common thing which you see after febrile seizure. Once the child is recovered and if the child is all well, immediately take the child to a nearby pediatrician so that he can assess the child and he can tell you what is the reason for fever and give you appropriate medications.